We have Dr. Partha with us, all the way from Orchid Fertility in Dubai Healthcare City. He is the Deputy Medical Director at this place, and he will be talking to us about IVF as a treatment. He's going to be busting some myths as well. He's going to be talking about success stories, the pressure, and so much more. Doctor, welcome once again onto the show.
Thank you so much for having me here.
Great. So before we went on to a break, we were speaking about IVF, the treatment, and you did briefly mention about the success rates and the emotional baggage. Now let's talk about an important factor. It's called infertility parameters. What are they and how does one measure them? Because I believe they're different for men and they're different for women. So how would you like to measure?
All right. So this is what infertility is all about. It is now classified by the World Health Organization as a disease. So infertility is, a couple is said to be infertile if after 1 year they have not been able to achieve a conception or a pregnancy.
Right.
But this 1 year duration is reduced to 6 months for ladies who are 35 years and more than that. Right? So if somebody is married and for 1 year and they have still not been able to achieve a pregnancy, then it would be wise enough to reach out to their primary care physician for a check. Now, what does this check involve? And I would say it would be a kind of a well health checkup where the husband undergoes a semen analysis test to see if his semen parameters are within the normal limits. The wife undergoes a few blood tests, which are the hormones test. There is a specific blood test which is called anti-Mullerian hormone, AMH, which is a marker of ovarian reserve, and it predicts the number of eggs left in an ovary. Also, we can do an ultrasound scan of the uterus to see if the uterus is good, whether she has got any endometriosis, any fibroids, any endometrial polyps, and also we can see the number of eggs left in the ovary. And also a specialized test which is called the tubal patency test, which is a hysterosalpingogram to check the patency of the tubes. And it is a specific separate test which is supposed to be done on between day 7, 8 and 9 of the menstrual cycle. So if these basic tests are okay, then the couples are reassured and they are advised to have a few more cycles of planning at home. And if they are still unsuccessful, then they need to reach out to the fertility clinics for further intervention.
Right. But also with today's day and age, with the kind of food we consume and so many other parameters and so many other factors that play on to us, I know a lot of women who reach their menopause way before time and probably are unaware, thinking they've probably skipped their menses. It's probably gone by 2 months, 3 months, for them to only go back to the doctor and get a shock of their life that, they've reached their menopause. Is there something that can be done scientifically to reverse such things and they could be gifted the gift of life, maybe?
Muriel, you have asked me the most hottest topic, which we usually encounter in our day-to-day practice in a fertility clinic.
Right.
And that is the state of diminished ovarian reserve.
Right.
Where ladies as young as 25 years or as high as 35, 36 years, their follicular count or the egg count in the ovaries are in the diminishing state.
Ouch.
Now, why it happens, we really don't know. But because of a lot of tests that we do by scans and by doing the blood test, which is the anti-Mullerian hormone, we are able to diagnose this problem in a big group of ladies. And in our day-to-day practice, I would say if I see around 10 ladies with this kind of evaluation, 4 or 5 of them would be having a state of diminished egg reserve, means their eggs are less. Now, what does one do in this kind of cases?
How do you break such news to them, firstly? I mean, I'm tongue-tied right now because it's freaking me out knowing that I may reach my menopause anytime.
Yes. So this is a very, very sensitive state. The thing is, some of the ladies, they are aware of it. They are educated. They read books and journals and they know about it. And there are a few people who are absolutely unaware. And they challenge us saying that, doctor, I have my normal menstrual cycle to cycle 28 days. Why? And you are saying my egg reserve is less. Yes. The ovary is producing the optimum amount of hormones to get your cycles in place. But is it strong enough to get your reproductive and your child pregnancy hormones up to the mark? That could be a challenging situation, and that's where we step in and we counsel and educate them. And when we start talking to them and we take them through the journey of the fertility evaluations and treatment, they themselves realize that yes, I think my eggs are already in the diminishing mode, and I really need to act fast, and that would be in the manner of doing an artificial insemination or an IVF program. Now, what happens in an IVF program is that very cycle, if there are 4 or 5 follicles, we try to harvest all of them, trying to grow all these 2, 3, 4 eggs and trying to make embryos and keep it in the freezer for the future use.
And that's why women now start freezing their eggs in advance.
That takes us to the next level of
Right.
understanding that because we are diagnosing this state of ovarian reserve, we are ensuring our ladies and trying to talk to them and also dispel this understanding that if somebody is not ready to get married, if somebody is not ready to get pregnant right now, but please go to the clinics and do your checks of your reserve.
Correct.
Because if your reserve is on the lower side, it's better that you get these eggs
Right.
out and freeze them in the freezer. You can fertilize them later.
Correct.
But right now they need to get out of your body and store it in the freezer. And that's the concept of egg freezing. But not only this, egg freezing also is indicated in ladies who have been diagnosed with some kind of cancer or leukemia or lymphoma or any other kind of malignancies, and they have to start chemotherapy and radiotherapy because
Right.
those high dose of medications are detrimental to the egg growth. So
correct.
before one embarks to do this kind of treatment, they need to take these eggs out and freeze them.
Okay.
So these are the different approaches where we do the egg harvesting procedure and freeze these eggs, and we are discussing this with our clients, our patients, and making them aware that it is not at all bad to get this done, because it's like a fixed deposit kind of a thing, a
Correct.
security that you have in your name for future use. Because
Okay.
tomorrow, if you do not do this and after 5 years you want to start a family, you might not have any eggs.
Oh.
So this is the way. So science is there.
But shocking, right? I mean, back in the days. So what do you think has led to situation to be like this in today's day and
It
age?
is very difficult for us to say. If there is no other pelvic problems like endometriosis or any kind of illness or viral infections or inflammations or any kind of autoimmune disease, if those things are ruled out, then probably I think we are the victims of all the kind of foods that we have been eating for the past 35,
The
40 years.
processed foods,
The
yeah.
processed foods, and this really changes our epigenetics. The DNA level changes. We know
Right.
it gradually over years has an impact and on our health, and in the long run we really don't know what's going to happen to our future generations. So, but again, with every problem there is a solution.
Right.
In today's day and age, we have a solution that we are able to answer this group of women with diminished reserve or having a difficulty in achieving a pregnancy by getting their eggs out, making their embryos, freezing them, and then replacing them back at a later stage.
Correct. So, but then there is no way to reverse once you've hit menopause, right? Or has science reached that level?
No, so these are still in the research stage. For ladies who are in the diminished ovarian reserve, where there are not too many eggs or follicles left in the ovary, now the recent advances are in the form of stem cell therapy or doing what we say is the PRP injection of the chemical inside the ovary to rejuvenate the ovary. But again, as I said, these are in the research stage. It does not change the scenario.
Oh, that's actually saddening, doctor. I mean,
Yes.
I wish, science gets to a point or medicine gets to a point where we can try and reverse this. I mean, with life on Mars and everything, I'm assuming this can be reversed too.
I know. You know what? We are talking about making a life.
I know.
Making something in Mars is okay. I know it's very this thing, but this is about life. That spark of life that I would name it. It is not easy as it looks. And
But I just hope.
And there is a lot of thing that doing IVF is magic science that I will get pregnant. No, IVF is not magic science. Fertility treatment is not magic science. It is just a modality of a treatment which can fast track your time to pregnancy.
Right. That was beautifully said, doctor.